I get a call from Nurse Ratchet from the West Palm Beach VA. And she says, "Oh, Mr. Spearing." I said, "Yes, this is he." She says, "Well, I want to tell you your results." Now, I'm ready for it. So she says, "Well, you have cancer." So my first thought was, wow, how relieving that is to know that I'm going to die of something that I know I'm going to die of. A lot of people don't know they're going to die, and then it happens. So I said, okay. And she says, "Oh, no, you don't understand. You have three forms of cancer. You have a slow mover, you have a medium mover, and then you have an aggressive form of cancer." So I asked the lady, I said, "Nurse, if I do nothing right now, just hang up on the phone and go hop on my Harley and go off in the sunset, what do I got? What's my chances?" So she says, "You have 12 months to 2 months, 12 months to 2 years if you do nothing." So I decided, I said, "Okay, well, what treatment plan do you have for me?" And she says, "Well, we can give you radiation, chemo, and surgery. All of these folks are killing you to kill the cancer that's killing you. There's nothing good about any of this poison." So I elected to take the radiation because you can pinpoint it. And today, 20 years ago, it wasn't possible. So during this time, when they set up the time for the radiation, I went to the beach and I needed to have a miracle. And I get this phone call 2 minutes later, and it's a voice I know well, for I had met this person a few years earlier down in the Keys. And it was an angelic voice. And she tells me that she has a gift for me of life. And I said, "A gift of life? Okay, what is it?" So she explains what it does and how I can get it. And I signed up instantly. I said, "I want this right now because I asked for a miracle. Here it is. How can you walk away from something like this?" And during this time, I set up my radiation period. So I would go through 90 days of the patch and 45 days of radiation. So after my treatment, I said to myself, well, I'm going to go live my life, be the best grandpa I can be, and not worry whether I got cancer anymore because they can't do anything more for me. And I was not going to take chemo. So in 90 days, I was going in for another blood test. So I did. This was the beginning of December. I go in for my annual blood test, and my doctor calls me in and she says, "Everything looks great. You've got the results of a 40-year-old. However, let's look at the PSA." So she turns a page and she looks at the PSA number and she goes, "Wow, I've never seen this in my career." So now I'm thinking, okay, well, I'm either a couple points higher and I'm going to have to go through all this radiation again, or at best, I'm a couple points lower and it's working. Well, no, she says, "Captain Silky, your number is 0.05 from a 6.1. So I'm not even in a contender now for cancer anymore."
I got diagnosed with no indication whatsoever at the age of 42, 43 with stage 4 non-Hodgkin's follicular lymphoma. So basically what that is in a nutshell is blood cancer. You have bone marrow and bone involvement in multiple areas of lymphoma in your body. And let me just tell you, if you're on here tonight and you have recently been diagnosed with something, and I'm talking right to you right now, if you have recently been diagnosed with something or you've been dealing with something for a long time, I know that everyone comes to you with their, what I call voodoo witch doctor magic tricks. Okay. I was told everything from I needed to go to Germany and live in a chamber to I needed to go to Arizona and get in a hot tent to I needed to eat mushrooms that turkeys had defecated on to, I mean, it was like unbelievable. All of the thing, people were going to drive from Michigan and bring me marijuana. I mean, it was unbelievable what medications and treatments people were going to bring to me. So here I am talking to Dr. Stacy at this beautiful pink palace on St. Pete about stem cells and stem cell research. And I'm just going, okay, whatever, lady, you know, I don't know you. I don't know what this research is, whatever. So I go back to North Carolina, where I'm from, and here I go through this traditional chemotherapy regimen. It was horrible. I was sicker on the treatment than I was already with stage 4 cancer. So halfway through the first part of the treatment, my doctor and I decided it was best for my health and my longevity to stop. So I stopped treatment because it was so hard on my body. And he knew that I was into health and wellness, and he said, let's just wait a couple of months and see. All right, so this is 2014. I worked with nutrition, I worked with diet, and it just kept going up and down, up and down, up and down, coming back and forth, back and forth. 2017, we fast forward, huge, massive reoccurrence of the cancer. With non-Hodgkin's lymphoma, you don't ever get the word remission. You get the words watch and wait, because they say, let's just watch it and wait till it comes back, because there's no such word as remission. Okay. So 2017, huge, massive reoccurrence of the cancer. I'm preparing myself for a port. I'm preparing myself. And I said, Dr. B, let me just really work on this again. So I work on it again with my nutrition, and I get what's called leveled out, that I don't have to have treatment again, 2017. So here it is, 2021. I get this call from this girl in Sarasota, Florida, and she said, girl, I don't know, but I just thought of you, and I know what you've been dealing with in your health, and you've got to try this patch. And I was like, okay, okay. And the thing is I just trusted her. I trusted her. And I haven't had a product brought in front of me in more than 10 years that you just have that little feeling, you just have that little tingle that you go, okay, God, this is a divine message. This is a divine appointment. I don't get it, but whatever is in this little packet, it's time for me to try something new. It's time for me to try something different. So June 1st, literally, I get my first patches in the mail. I start putting them on. Now, my last CT, because I'm still considered an active patient, was in January of 2021. And I was considered leveled off, but still cancer present. July 15th, after 45 days of using X39 and the Anon, I went in on July 17th to see my oncologist after my July 15th scans. And he said to me, in 6 years, you have never had a scan this good. You are almost cancer-free. Every one of your levels is smaller. I don't know what you're doing, but whatever it is, don't tell me, but don't stop. I am going to do something they say is not possible with stage 4 non-Hodgkin's follicular lymphoma. I am not only going to go into remission, I am going to be cancer-free. And so I cannot wait. I got a 1 year for the first time ever, a 1 year clear. I do not have to go back to an oncologist for 1 year.
My dog, I take the X39 at night. When I take it off, I save it. The next day, I tape it on the inside of his collar, so it's right over his spinal cord. He had a wound on his lower back side on this spine, and the doctor said it was cancer. And he said if it didn't heal up soon, they were going to do a biopsy and see what kind of cancer it was and what they were going to be able to do for him. I put that patch on, and within about 30 days, wearing it every day, my leftover, and it healed up. And and he had it for like a year, and it healed up in 30 days, and he hasn't had a sign of it since. And the doctor's like, I can't explain it, because it definitely was cancer, but he said it's gone now.
So in 2017, I had a pretty massive car accident. It totaled my car, totaled me. I had 2 herniated discs in my neck, 2 pinched nerves. It separated my eyeball from the gel sac in the back. I had a concussion with a brain bleed, torched sternum, 4 dislocated ribs, sprained wrist, sprained knee, bruised on the entire left side of my body, just black and blue, all the way from my shoulder all the way down. The pain had been excruciating. And of course, through a lot of different therapies and stuff, I did see a neurosurgeon who wanted to take C7 out of my neck and put a plate in and screws and stabilize that, along with C4. And I had those 2 pinched nerves, and I told him, no, thank you. And I asked him if he had heard about stem cell therapy back then. That was in 2018, actually, when I was still having problems. Numbness in my hands continuously. Can't even hold a cell phone without my hands going numb. And so as a bodywork therapist, that's kind of hard. I'm always having to take my hand out and shake it and everything like that. So I refused the surgery, told him I would look further into it. And so I've been looking at stem cell therapy. And of course, the injections are pretty expensive and different stuff. So when I saw you and you said, hey, I've got these patches and this is what they do, they stimulate your dormant stem cells. And I was like, what? So Stacy put a patch on the back of my neck on C7. And I went into the conference and I came out in about an hour and a half. And I'm like, what is in those patches, girl? I could feel the stimulation in my neck. I could feel the activity of the stimulation of those stem cells that quick. And I could also feel them in my brain. So moving forward, 6 weeks since I have been on those patches, I immediately signed up to get my patches, like right there on the spot. Sign me up right now, because I could feel the difference. And what has happened and transpired over the past few weeks is gradually I have gotten rid of at least 75% of the numbness in my hands. They don't go numb when I'm on the cell phone anymore. I don't have pain in my neck. I don't have the headaches. My clarity of thought is better. And then as a result, I believe, of that accident, I also had diagnosed with stage 2 breast cancer in that left breast that was badly bruised in that accident. I went to Mexico. I had a lumpectomy done. I didn't do any of the other conventional treatments, as far as I did no chemo or radiation, but I did a lot of hyperbarics and stem cell replacement therapy while I was in Mexico. And I went to my oncologist acupuncturist about 4 weeks ago, and I was having some inflammation 5 weeks ago in my breast. And I'm scheduled to go back for my follow-up mammogram in August, I think 9th it is. But she said she immediately wanted me to go. And I said, well, wait, I'm trying these patches. And this is what they do. And they bring down inflammation and different things like that. Let me try these. I went back to see her the next week, and she was like, your breast is totally fine now. And she said, you don't have to come back and see me for at least a couple of weeks. And then when I went in to see her this Tuesday, she was pretty blown away and wants to know everything about the patches and what I'm doing.
My husband had 2 cancers last year, 3 if you count the one on his nose, but very, very serious. And he ended up having to do 8 in-hospital stays with chemo. So now he is cancer-free, but what it left him with was really severe chemo brain fog, like you can't imagine. We would have conversations, and I know that we had them before, and it was like the first time he had heard them, and gee, I didn't know that. And so I said, you know what, Stacy, let me buy a month of your patches from you, and we'll put them on Eddie. So after about 2 weeks, I mean, it was like 180 turnaround. This is a very articulate man that can speak very freely, is very knowledgeable, and had gone from that type of speaking to searching for words. And so I saw that whole circle turn around, and I thought, oh my goodness, I want to slap these on myself.
Everything that Adele said has been absolute 100% true. 3.5, 4 months ago, I found it very difficult to concentrate speaking to people. Imagine you're trying to close a deal, and in the middle of it, you just go, and everything's gone. Wow. And you look at the person that you're talking to, and you go, Can you tell me what we were just talking about? That's how it was. It was really, it was crazy. These patches are a godsend. I'm so grateful for them. And I can't wait to continue to grow with them.